everyone. This is the first recording for a series of recording in relation to project management. The topic for today is needs analysis. I will cover some of the key points for needs analysis to highlight why it is important and why it's critical in designing projects. And nowadays, a project is a common way of getting things done or getting work done. In healthcare, the project has become more and more important, varying in size, extent and subject. Before writing this book, Project Management in Health and Community Services, my colleagues and I spoke to a number of senior project managers, planners and policy makers, and found project management has been applied in healthcare in 4 key ways. That's including testing a new intervention model or developing a new service model, improving service standards and quality and processes, implementing new organizational structure or systems, upgrading facilities, and installing new equipment. For example, if we are considering in an investment in a new service with an extensive scope, it makes sense that we need to test it. What model works the best? Whether it is acceptable by future consumers? Are there potential risks and barriers? Such testing can be in a project form, which is limited and balanced by time, budget, and quality. So from my point of view, project management is about improving the way that we do things, such as providing services to the population by learning in a controlled environment, controlled by these 3 key factors. And project management is about change management because we are changing for the better. We are matching the best solutions to the problems. Therefore, change management principles should apply. This may include assessing the readiness for change, consultation and good planning. More importantly, how can we sustain the change as the result of the project? To allow a project to serve its purpose for improvement, the project design is critical. The important first step in is to conduct a needs analysis, which includes 3 key elements on which a good project proposal and project plan will be based. That's including the first step is assessing the scope and urgency of the problems to be addressed. And then the second step will be, I will cover that later on, the service gaps identification and identifying the best solutions. In Australia, health expenditure was around 9.4% of the total GDP in 2015. Australia is one of the 15 countries that spends more than 9% of total GDP on health. A lot it is, but the reality is, although we enjoy longer life expectancy and better health outcome in comparison with many other countries, we still have not achieved equality in health service provision and health outcomes across the Australian population. There are large gaps between what our health system provides and what the needs of the population are. Therefore, every project we design needs to justify the importance and argue why the projects deserve to be funded. The truth is, we are competing for limited resources. If our project gets off the ground, there will be other projects get buried. The first step of confirming the scope and urgency of the problem to be addressed is the critical first step of needs analysis. So see, this is the money pie. That's how much money we got. If there's 200 projects proposals put in, there's only 100 get funded. So we need to argue we are among the 100. There are many ways to conduct the first step to identify the problems and the needs. That's including assessing existing databases for epidemiological data to understand disease distribution and trend, and allowing comparative analysis. We can also access databases such as Australian Bureau of Statistics, Australian Institute of Health and Welfare, and other government databases for demographic of specific population groups such as age, gender, social and economic factors. Also, we should not forget the voices of our consumers, carers, and the experience of health professionals. Community consultation and stakeholders forum are common ways of getting such views. When I'm teaching project planning, development and evaluation, my postgraduate students are sometimes unclear of the reason why social and economic factors are important. Let me give you an example. Assuming local government area A and local government area B both have very high smoking rate amongst the people aged between 35 and 50. Both councils would like to support an initiative to address the high prevalence of cigarette smoking among this age group. So a very common way, promotional way of doing that is a promotional and prevention strategy to be implemented via a media campaign and to educate about the dangerous cigarette smoking and also the adverse health outcomes in relation to smoking. So do you think that we can simply assume that such strategy will have the same outcomes in both local government areas without considering understanding the social economic factors? Think of it this way. If the majority of the people aged between 35 and 50 living in local government area A are educated and fully aware of the negative impact of cigarette smoking, what does this mean? It means they made an informed decision to maintain that habit. So a media campaign focusing on knowledge improvement is not going to influence the attitude towards smoking. Therefore, a change of behavior is unlikely to take place. And for this analysis, the second step is the service gaps confirmation. We need to ask ourselves, we have needs and problems we can see and prove. Is that in fact a gap? There may be a problem, but sometimes not necessarily is an indication of lack of services. For example, like in Hospital A, in the past few years, there has been a constant increase in admission of patients with dangerously high blood pressure. So the majority of these patients have been diagnosed with high blood pressure and have been on medication for a number of years. But they are admitted to the hospital. And the data in the past few years indicated that inappropriate self-medication, lack of physical activities, and poor diet were likely the contributing factors to the acute high blood pressure episodes led to the admission to the hospital. So these episodes, in fact, are preventable by improving patients' self-medication practice, good diet, and adequate physical activities. To reduce the necessary demands on hospital beds in the future, Hospital A will need to do something about it. So what can they do? The question is, what should Hospital A? Should they just simply develop some educational programs and follow-up services after patients are being discharged? Yes or no? Yes, if there are no such services in the community for patients to access. So we need to do something about it to prevent the future acute episodes to take place. But what about there are services in the community, but the patient not aware of? Then a better referral pathway between the hospitals to the community services may be what's needed rather than the creation of a new service. What we want to do here is to maximize the efficiency of existing services rather than duplication, because financial constraint is always a challenge for us to face. And so once you confirm there is the first service gaps and what type of gaps are in existence, the next step to do is to investigate what's the best solution. So this is a way commonly looked at international and national literature to look at what are the best models have been tested. But we need to bear in mind, we need to understand the context in which these interventions were implemented. Sometimes interventions work best in this area and in this population group, may not work in this area, the other area in other population group. So we need to be really careful about that. Once we know all the possible solutions, then we can decide what would be the best solution for the problem in consideration of all the evidence we generated in the first step, the problems and needs, and from the first service gap. So understanding the disease distribution, understanding the social economic factors that contributing to this disease and all other factors, and also availability of services and limitation of services and the capacity of the organization that can provide such services. Then we decide what will be the best model to match the problems that we want to address. Let's sum up my presentation by one remark. A good needs analysis is a critical step for a successful project planning or successful project management. Thank you for watching.